How long do hemorrhoids last? Hemorrhoids can be a source of both pain and embarrassment. If you're wondering how long they last, you're not alone. Hemorrhoids are swollen veins in the rectum or anus. They can be caused by pregnancy, straining during bowel movements, or chronic constipation. Hemorrhoids often go away on their own, but there are steps you can take to speed up the healing process. What are hemorrhoids? Hemorrhoids, often called piles, are swollen and inflamed veins in the rectum and anus. Hemorrhoids can be external, which means they are located under the skin around the anus, or internal, which means they are located inside the rectum. Hemorrhoids are a common problem, affecting up to 75% of people at some point in their lives. They can cause pain, itching, and bleeding. There are a number of elements that increase the chances of having hemorrhoids. If you have had constipation, you will likely develop hemorrhoids. Also, if you don't do regular exercise, you may be more likely to get hemorrhoids. It can be hard to go to the bathroom when you have hemorrhoids. This makes your stool wet and sticky. It is also difficult to pass through the anal opening, making it harder to empty your bowel. How long do hemorrhoid symptoms last? Your hemorrhoids may not seem like such a big deal. After all, hemorrhoids aren't usually painful, and they can quickly go away on their own without any treatment. Neglecting the condition can cause more situations to develop later on, such as forming a blood clot. These have also been known as prolapsed hemorrhoids. If your prolapsed hemorrhoids are left untreated, they can require intensive medical treatment. They can occur if the rectum is enlarged during pregnancy due to the pressure in your abdomen. Pregnancy hormones may also increase your odds of having swollen veins. If you develop hemorrhoids during pregnancy, your symptoms may last until you give birth. What are the symptoms of hemorrhoids? Internal hemorrhoids are caused by the enlargement of veins around your anus. If internal hemorrhoids are pushing out of your anus, they may bleed during bowel movements. In fact, some people with internal hemorrhoids may not experience any symptoms or be aware of their condition. External hemorrhoids are usually characterized by rectal bleeding, itching, swelling, burning, and constipation. What can you do for relief? Heavily pooed people tend to have more problematic hemorrhoids than lightly pooped folks. If you require hemorrhoid remedies, here are a few easy ways to fix that problem. If you're constipated, avoid sitting on the toilet. Instead, try to move around as much as possible throughout the day to keep yourself moving. That said, here are some other things that may help relieve symptoms. Many people don't realize the importance of being careful about their bowel movements. Don't be one of them. Ask your doctor if they think you need to take a stool softener or a fiber supplement, such as psyllium, metamucil, or methylcellulose, Citracel. An additional suggestion is to drink plenty of fluids. Take regular showers and use moist wipes to clean the area around your anus after passing a bowel movement. Use a sitz bath or sit in a warm tub for a few minutes to bathe the anal area. Try over-the-counter, OTC, topical medications to ease discomfort. You can try phenylephrine hemorrhoidal gel, preparation H. What are the treatment options? Small hemorrhoids can often clear up without treatment or with home treatment and lifestyle changes. For those who have continuing problems or complications, such as bleeding, it's essential to get medical help. Other causes of bleeding during bowel movements, such as colon cancer or anal cancer, can be ruled out by your doctor. Your physician may recommend medical procedures to remove or minimize the hemorrhoids. Your doctor may also recommend a minimally invasive outpatient treatment. Some treatments include the following. In most cases, rubber band ligation, RBL, is the most common non-surgical treatment. An appendectomy can be performed by your physician when a band is tied around the base of hemorrhoid to block off the supply of blood. Any 80% of people who receive treatment for hemorrhoids undergo this procedure. When you have severe hemorrhoids, several methods are available to treat them. However, if a doctor has ruled out all other causes and the problem persists, they may recommend surgical removal of the hemorrhoids. This was shown to provide symptom relief and reduce future outbreaks. What are the risk factors for hemorrhoids? The risk factors for hemorrhoids are many and varied. Some of the most common are age, obesity, pregnancy, and constipation. Other potential causes include genetics, sitting for long periods, and chronic diarrhea. Hemorrhoids can also be caused by certain diseases or conditions, such as Crohn's disease, lupus, and cancer. It doesn't affect how long do hemorrhoids last, but here are some more risk factors. Obesity, pregnancy, age, frequent constipation or diarrhea, not having enough dietary fiber, anal intercourse, overusing enemas or laxatives, spending too long sitting on the toilet. Spending too long sitting on the toilet. Will your hemorrhoids return? Hemorrhoids aren't necessarily benign. Even if they seem to disappear, they may still be there. Recurrence happens about 60% of the time after surgery for hemorrhoids. And they tend to come back soon after people stop taking pain medications. Some of the study participants received treatment at home, and others had surgery to remove their hemorrhoids. Hemorrhoids recurred in 6% of the people who had surgery and 25% of those who received at-home treatment. Tips for prevention. Hemorrhoids are highly sensitive vascular conditions that occur around the anus. While hemorrhoids can be a nuisance when you have them, they usually heal themselves with time. You can follow these tips. Along with drinking lots of fluids, it's important to eat fiber-rich food as well. Try drinking a glass of water or milk every time you go to the bathroom, and try to incorporate fiber into your meals. You'll see a difference between your digestive system and your health. You can generally reverse the discomfort of hemorrhoids using stool softeners. It can help you stay more regular. Exercise helps, so get moving. When should you see a doctor about hemorrhoids? See a physician if you experience bleeding during a bowel movement or have severe hemorrhoids. The doctor can then take steps to treat the problem. Many patients feel awkward talking to their doctors about their health concerns, but you shouldn't be shy. Your doctor is there to help, and you are certainly not the first patient they have seen with this problem. Talking to your doctor is the best way to get the help you need and the relief you want. When you talk to a doctor, they can help you figure out a suitable plan for you. How a doctor can help. Doctors can recommend treatments, including things like antibiotics and medication, to reduce or prevent hemorrhoids. Some of these procedures can be done directly in a doctor's office and have a minimal degree of discomfort, medicated creams or ointments. Doctors can prescribe stronger creams and ointments when an OTC hemorrhoid cream is insufficient. Minimally invasive procedures. There are some minimally invasive procedures that a doctor can do in his office or an ambulatory surgery center that typically doesn't require anesthetic or long recovery times. Some of these procedures are utilized for rubber band ligation, sclerotherapy injections, and laser/infrared coagulation treatments. Thrombectomy. For complicated situations that trigger blood clots and result in much pain, your doctor can perform an external hemorrhoid thrombectomy to remove hemorrhoid. The best time to perform a thrombectomy is approximately 72 hours after the onset of pain. Surgical procedures. Several surgical options are available when other treatments and procedures haven't worked. If you cannot achieve the desired relief through other methods, talk to your healthcare provider to see if surgery is the best option for you. How are hemorrhoids treated at home? In some cases, hemorrhoids will go away on their own within a few days, including prolapsed hemorrhoids. However, if you are having trouble with the bleeding, eating more high-fiber foods, such as whole grains and green, leafy vegetables, and drinking plenty of fluids, especially water, can help reduce the irritation. If your gut has been stressing you out lately, try to avoid straining when you go to the bathroom. A fiber supplement or gentle stool softener may help. You might also benefit from taking a warm bath or sitz bath, which is a shallow plastic tub that allows you to sit in just a few inches of water. Sitz baths are available over the counter. Adding Epsom salt may help to soothe the irritation. Be sure to dry the area thoroughly after a bath. Over-the-counter hemorrhoid creams or suppositories can help relieve mild symptoms, such as itching, pain, and swelling. Living with hemorrhoids. Hemorrhoids are an uncomfortable and sometimes painful condition of the lower rectum and lower anus, characterized by swelling and often itching. Most people with hemorrhoids go through their first episode around the age of 50, though it can occur at any age. In conclusion, there isn't a definitive answer for how long do hemorrhoids last. Hemorrhoids can last anywhere from a few days to a couple of weeks. While there are many home remedies and over-the-counter medications available to help treat them, they may require surgery in some cases. If you are experiencing hemorrhoids, be sure to consult with your physician to find the best treatment option for you.